Hi guys, welcome back to my channel. As some of you may already know, I am a pediatric nurse. I qualified last year, and last month was 1 year since I started working. I should have done this video last month, but it didn't happen, so I'm doing it now. So yeah, been working for a year, and if you don't know what pediatrics is, it's basically children. So I work with children. I'm a children's nurse, and I really love my job. And I know that there are new nurses who have started either last month or are starting this month, and I thought it'd be really helpful to do a video on things that I've learned and top tips as well. So yeah, so I'm going to talk through 5 things I've learned in my first year of nursing and 5 top tips I have for you guys. And this can also be helpful for you if you're in training at the moment and you're a student nurse. So the first thing that I've learned is that you'll never know everything. Like, it's not even possible to know everything. Like, things are always changing in nursing. You're never going to know everything. It's okay to Google things. Sometimes you can get a patient and you don't even know what condition they have. Google it, find out what it is. You're never going to know if you don't find out. So it's okay not to know everything, and the sooner you realize that, the better it is, so that you don't beat yourself up for not knowing certain things. So the second thing I've learned is that you know more than you think you know. Sometimes when you qualify, you're just like, I don't know anything. How am I going to look after all these patients? But you know more than you think you know, because if you didn't know, you wouldn't have qualified otherwise. So yeah, you know more than you think you know, and your sign-off mentor wouldn't have even signed you off or had that confidence to put their pin down to sign you off. So you know more than you think you know. Third thing I've learned, ask for help. You cannot do everything by yourself. And this one I am still learning, because sometimes I feel bad for asking for help. But asking for help doesn't mean that you're not capable of doing the task that you've delegated. It's actually a good thing that you realize that you can't do everything, and you need to maybe pay attention to one patient more than another, and you need someone else to maybe do some observations for you, or put a milk feed up for you, or give a certain medication for you. It's okay to ask for help, so please ask for help. You know, everyone is there to help you, and if there's someone who is not free, don't be afraid to ask another person, especially if they're not as busy as you are. And don't feel bad. I'm working on that one still. So number 4, follow your instinct. You know, yes, we use machineries and machines on our observations, but follow your gut instinct. If you feel as if something's not right, something's probably not right. If you have concerns and something in your gut is like, I don't feel like this is okay, raise the concern. I remember I had a social concern about a patient, and I told the nurse in charge, and she couldn't seem to understand where I was coming from or have the same concern that I had, because remember, it was me that had that gut instinct, not her. So I told another nurse, and she was like, I can understand where you're coming from, like something's not right, escalate it further to senior management. And I was like, okay. So I escalated it, and obviously they formulated a plan with that patient, and I'm so glad I escalated it, because I felt so at peace afterwards, because I was like, imagine if I didn't escalate it. Like, I would just be left thinking, what if? So be firm and be confident that you know that something's up. You might not know exactly what it is, but don't back down on it just because no one else can see what you're seeing. So yeah, that's number 4. Number 5, shift work is exhausting. Book annual leave when you start. Book it ahead so that in 3 months time you'll have a week's annual leave or 2 weeks annual leave. Like, you'll get tired, because as a student nurse, you go on placement for, let's just say, 6-7 weeks, then you go back to uni, so you have a little bit of a break. Once you start working, it's continuous. So make sure you book annual leave, and book it well in advance, so that you'll be able to get your annual leave approved. So yeah, those are the 5 things I've learned. Now moving on to the 5 top tips. So my first top tip is to be proactive. Be proactive in your learning. If there's a skill that you want to learn, go and seek out the nurses who are able to do that skill. If there's a study day that you want to go on, email about it. You know, they send out, I've noticed that they actually send out emails, and sometimes we just skim through it. Read the email, and go for the study day if you want to learn about that particular thing. It's for your learning, it's for your development, so be proactive. No one's going to come and spoon feed you. That's what I'm trying to say. It's not, you know, you're not a student anymore, you're actually a professional, you're a qualified nurse. Be proactive in your learning. So yeah. Tip number 2, ask loads of questions. No question is a silly question. I probably asked more questions in my first year of nursing than I did in my third year as a student nurse. And I think I had the mindset that because I'm in third year, I should maybe know this. So maybe I'll ask someone who won't think I'm silly. But I've asked so many questions in my first year of nursing, and the thing is, if you don't ask, you won't know. And as I said earlier, you're never going to know everything. So ask loads of questions. That's how you learn. My third top tip is give yourself time to adjust, especially if you're newly qualified, you're starting in a new, you're in a new role already, you're now accountable for your patients, you might be starting in a new hospital, or you might totally move trusts as I did. Give yourself time to adjust. I'll say 6 months is a good time frame to give yourself time to settle in and adjust. Don't be too hard on yourself. You know, you won't get everything right the first time. Just give yourself time to settle in and get used to it. There will be good days and there will be bad days, but they're not a reflection on you. Because I remember I would beat myself up a lot when I started. You know, sometimes the shift would literally just go to pots and I was just like, why? I remember just bursting into tears when the matron asked me what's wrong, and I was just like, nothing's going right. But it happens. It's nursing, and if you're newly qualified, you already know that because you've done 3 years of training. So number 4, have go-to resourceful people. There are people around you who are resourceful, who have more experience than you. Learn from them. You know, there's probably people that you would gel with that are more senior than you, so those are the people that could be your go-to people, or like your, not mentor, but your preceptor, or maybe someone who's there to support you, who can just take you under their wing and like support you as you transition from being a student nurse to a qualified nurse. So use your go-to resourceful people. And also there are some nurses who have been there for 20 odd years and you might find them intimidating, but they are literally full of knowledge, so use them. Remember to remain professional. You might not gel with them personally, but they are a professional, you're a professional. Use them to build your learning and to build your development, essentially. And number 5, reflect on what you've done well, reflect on what you haven't done well. Reflection is so important in nursing because actually reflecting makes you a better nurse. And as you already know, we need to reflect as nurses because our revalidation is every 3 years. So make sure you are reflecting on your practice, write it down and put it in your portfolio. It's so important. So yeah, those are my 5 top tips, 5 things I've learned. Oh, and a bonus is it's okay to cry. You are still human. Obviously not uncontrollably all the time, but it's okay to cry. Sometimes I cry, but then again, I'm a crybaby. But yeah, so I hope this was helpful to someone. Congratulations if you're starting out your new job, and yeah, give yourself time to adjust. You'll be absolutely fine. You know more than you think you know. So yeah, thanks for watching.